What's up, YouTube? This is Kevin Martin, aka Red. Currently we are in Kissimmee, Florida, right? Kissimmee, Florida. This video is about my corneal transplant that I had 24 days ago. So we're at day 24 post-op, and I'm sitting on the balcony. Me and my wife, we are from Murfreesboro, Tennessee. So we traveled about 680 miles yesterday. Was it yesterday? Yesterday, we got here yesterday. I drove most of the way. I think once we got close, like about an hour away, the light started to come, the sun started to set, and I think we made a pit stop for some gas, and I let my wife take over from an hour away. So I could see very well. When I had the surgery, like I said in the other videos before, my vision was corrected right away on this eye. So this is my left eye. So I had the surgery on my left eye. It's not all the way, even ready to open I can hold it open now. At first I couldn't hold it open, but once the pressure, what did it go up, right? Does it go up or down? Went up, I guess. I was able to hold it open. Before I would try to open it and it just wouldn't want to stay open. So I'm wearing these still because it's still some light sensitivity, right? It's still some light sensitivity. I want to make sure I'm saying the right words for you guys. So it's still some light sensitivity, and I kind of just it's comfortable still with the, I can still see, but it's comfortable with the, at night still, even though it's nighttime, I still keep them on. But also, I have, in this eye, I went and got my, say it for me, babe, the lens, scleral, right? Scleral contact lens for my keratoconus for my right eye. So I got that right before, like on the last Wednesday, this past Wednesday, I got them, and they fit really good, and I can see, better. Not perfect, but I can see. And I give you something about it, the sight. Before I had the surgery and the contact, hey, so y'all, speaking of WrestleMania, I'm watching the WWE Network because we're on the road to WrestleMania. Anyway, we were on the road. But before I had the surgery, I would still try to drive because I didn't like my wife driving all the time, but I would try to drive her when she goes somewhere or when we go somewhere. And I couldn't see well, but it got to the point where I could not drive at all. So I stopped driving totally, and I just knew I couldn't do it anymore. But I shouldn't have been doing it before I stopped. I should have stopped way before I stopped. So now, I can see enough to drive. So we were on our way here, and I'm telling you, man, like this car, man, just came out of nowhere on our right side on the interstate. And I was in the fast lane. Car almost wiped us out, man. And thank goodness there was no barrier to my left. I was able to get off the road. I seen it. My wife seen it before I did, though. And when she saw it, she screamed a little bit, and I was able to look. I was able to check all my mirrors before I made my move. And I'm going like 80 miles an hour, man, to 85. And this car was going faster than me, and it switched lanes without looking. I don't know how it didn't see me. I'm in a big Ford Flex, black Ford Flex. I don't know how it didn't see me. It was almost like they was trying to run us off the road or something. But I was able to get off the road, hit the brake a little bit, and jump back on. But without that surgery, I would have been done. Like if I would have been still trying to drive because it was daytime, without that surgery, without this contact in my right eye, because that's where the car was coming, I would have been done. We would have been done. We wouldn't have made it here. I'm sure of it. So it didn't happen though. So we just moved on from that. But I was just explaining that because that's how good I can see. So I went to Dr. Doherty from Loading Vision in Nashville, Tennessee, the Green Hills area. And he did the surgery for me in Goodlettsville, Tennessee. So he's got offices up in Middle Tennessee, so up and down Middle Tennessee. So I think the best doctor in Middle Tennessee, right? Yeah. I think, right? Yeah. So and you know, Dr. McCabe in Murfreesboro, Tennessee, and Dr. Cook in Murfreesboro, Tennessee. And they took care of my right eye so far. So I'm going to have those guys working on my eyes from here on out. And it's not over yet. This is day 24. I still have, you know, light sensitivity and stuff. I still feel the how you say it? Sutures? Sutures. I'm trying to get these terms right. That's why my wife is helping me. Sutures. She's the medical person. She know all the terms and stuff. Sutures, I can still feel them a little bit, but not as much. The swelling is down. My eyes not leaking. I'm still taking my meds every day. You got to take your meds every day. Don't miss out on your meds, please, because you won't heal it won't heal if you don't take the meds. Always follow up with the doctor if you got questions. They'll probably tell you to come in. It's been times where they set appointments for me, but because I had questions, they would just tell me to come in, and we just take the ride to go in just to make sure we stay on schedule with the healing, just having questions, and they monitor you very well. Also, I got Refresh gel drops. And anytime I feel a little discomfort or feel a little dryness, or I could feel my eye draining, my doctor told me the reason why that's happening is because my eyes were dry. So I use them and I check with my I put them in. I was using that. She gave me that, my Dr. Cook from Murfreesboro, for my contact lens. She gave me those drops. So I've felt to call my doctor that did the corneal transplant and asked them, is it okay for me to put those drops in my eye after the surgery? And they said it was fine. So I use them in both eyes, and it's not expensive. They like what, $7 for a bottle, a little small bottle. Yeah, a little small bottle. I should have brought a little bottle, but I'm just freestyling here. So this bottle about this big, but it lasts maybe a few days or a couple of weeks or something like that. Maybe a week or two, or maybe longer. I'm not sure, but it lasts enough. So look for some coupons for those, because you're gonna have to have those to stay lubricated on your eyes and stuff like that, to keep them from being dry, and they'll heal faster if you keep that therapy going, that kind of therapy going. So we got WrestleMania tomorrow. We got Universal Studios the day after that. So we head to Orlando tomorrow. We in Kissimmee right now. We're gonna check out of here and go stay where we check going to?
Westgate Lake.
Westgate Lake. Where's that? I don't even know where that's at. I don't know if it's closer to Orlando or not. I didn't even think to check, but it's around there somewhere. We're not far from Orlando anyway. Go. We like 25 minutes. Okay. The NXT TakeOver pay-per-view is on the WWE Network, by the way. It's $9.99, or you can get it on the web, whatever. But that's what we're doing. We're just hanging out, taking it easy and slow. We're not doing too much because, you know, you still got to, be careful. It's something, because I've been without vision for a few years, good vision for a few years. So, it's coming back to me. But without that surgery, I probably would have been messed up today. And I'm glad I was driving, because I don't know what my wife would have did in that situation. I had to get off the road going 80 miles an hour. I had to hit that brake. I didn't hit it too hard, but I knew I could get on off. It wasn't a dip or nothing where I could just get on off and get back on. So, yeah, close call, but thanks to the vision, we survived that one. And, it was kind of cool, too. My wife thought I was bugging out, but I thought it was cool. So I'm not going to hold y'all too long. We're going on 11 minutes right now. I'm enjoying the trip. I'm seeing well. I know I'm going to be able to see the ring well, and all the big crowd. We're expecting 85,000 people watching WrestleMania 33. So signing out, Kevin Martin. Like, share, watch, subscribe, comment, and peace out for everybody that's getting corneal transplant. If you got any questions, holler at me. If I don't have the answer, I'll try to get it for you. So these doctors are good, man, so they know what they're doing. So don't be afraid to get one. Don't be afraid. It seems like they kind of competing with each other to see who's doing the best job. So if you do what they say, everything's going to be all right. So we signing out with 12 minutes. April 1st, day 24, post-op, corneal transplant. Peace out.